Have you ever wondered why no one talks about it? That feeling of discomfort that appears when you least expect it. The dryness that makes moments of intimacy uncomfortable. Or even that loss of sensitivity that makes you question whether you can still fully enjoy your intimate life. If you've ever felt this way, I want you to know that you are not alone. Thousands of women over the age of 60 silently face changes in their intimate health, believing that they must simply accept this new reality as a natural part of aging. Many of us grew up in a time when these issues were not openly discussed. We were taught to keep our doubts and discomforts to ourselves. And when we finally seek help, we often leave the doctor's office with a prescription for synthetic hormones or expensive creams, without any explanation about other alternatives. As if our only option were to choose between discomfort or medications with worrying side effects. But what if I told you there is another way? A way that respects our body's wisdom and harnesses the power of natural solutions that women have been using for generations? Today, I want to share with you 3 powerful and natural solutions that can transform your intimate health and restore that feeling of comfort and pleasure you deserve to experience, regardless of age. Because I firmly believe that entering the best phase of life does not mean giving up our intimate well-being. In fact, with the wisdom we have accumulated and these natural solutions I am about to share, you can rediscover an even deeper connection with your body. Before we continue, I would like to know if you also face any of the challenges I mentioned. Leave a comment below sharing your experience, and feel free to ask any questions you may have on this topic. And don't forget to click on the subscribe button and activate notifications so you never miss our weekly women's health tips. Translated with deepel.com, free version. Our first natural solution for revitalizing intimate health after age 60 involves deep hydration with specific vegetable oils. When we think of intimate dryness, the first reaction of conventional medicine is to prescribe hormonal creams or artificial lubricants that contain parabens, glycerin, and other synthetic ingredients that can further irritate our sensitive tissues. What many healthcare professionals don't explain is that this dryness occurs not only because of decreased estrogen, but also because our bodies naturally produce fewer essential fatty acids as we age. These fatty acids are essential for maintaining the elasticity and natural lubrication of intimate tissues. That's why golden flaxseed oil is a real treasure for our intimate health. Rich in omega-3, this oil acts deeply on cellular hydration when consumed daily. Recent scientific research has shown that women who consumed 2 tablespoons of flaxseed oil per day for 3 months experienced a significant improvement in the natural lubrication and elasticity of their intimate tissues. This is because omega-3 works from the inside out, nourishing cells and improving blood circulation in the intimate area. Increased circulation means more nutrients reaching the tissues and greater sensitivity. To incorporate this oil into your routine, you can add it to salads, natural yogurts, or smoothies. It is important to remember that flaxseed oil should be consumed raw, as heat destroys its beneficial properties. In addition, it needs to be stored in the refrigerator, in a dark bottle, to preserve its nutrients. For women who have conditions such as high blood pressure or diabetes, this solution is especially beneficial, as omega-3 also contributes to cardiovascular health and blood sugar control. One woman who was hesitant about this simple solution decided to try it after much resistance. After just 6 weeks, she reported not only an improvement in intimate lubrication, but also noticed that her skin was more hydrated and her joint pain had decreased. This is because the benefits of omega-3 extend beyond intimate health, offering a holistic approach to well-being. For those on a limited budget, flaxseed oil is a much more economical option than hormonal creams, considering that 1 bottle lasts approximately 1 month and can be found in health food stores at an affordable price. An equally powerful alternative is evening primrose oil, especially for women who experience discomfort during intimate relations. Rich in gamma-linolenic acid, evening primrose oil helps to naturally balance hormones and reduce tissue inflammation. It can be consumed in capsules, following the recommended dosage on the packaging. To enhance the effects of these oils, you can combine them with an infusion of raspberry leaves, traditionally known as a tonic for the female reproductive system. I want to pause here to ask, have you also felt frustrated when healthcare professionals say that your intimate issues are normal for your age and that you just need to accept them? Or when they suggest yet another medication with side effects that worsen your quality of life? Leave a comment. Yes, I deserve natural solutions that really work. Your comment may seem simple, but it will show other women our age that we are not alone and that we don't have to accept discomfort as a normal part of aging. How many times have you felt that your intimate health concerns were not taken seriously? Today, we are changing that story together. Our second natural solution for revitalizing intimate health involves strengthening the pelvic floor muscles with an approach that goes beyond traditional Kegel exercises. Over the years, and especially after menopause, these muscles can lose tone due to a decrease in collagen and elastin in the tissues. This can lead to a decreased sense of pleasure during intimate relations and, in some cases, to problems such as mild urinary incontinence. Interestingly, many women perform Kegel exercises incorrectly, contracting other muscles such as those in the abdomen or thighs, without actually activating the pelvic floor. A more effective technique involves deep breathing combined with visualization. As you inhale deeply, imagine that you are welcoming air and energy into your intimate center. As you exhale slowly, gently contract your muscles as if you were interrupting the flow of urine. The secret is to maintain rhythmic, deep breathing, consciously directing energy to that region. Studies show that this approach not only strengthens the muscles, but also improves local blood circulation, increasing sensitivity and pleasure. For women with reduced mobility, these exercises can be performed in any comfortable position, whether sitting or lying down. Ideally, practice 3 times a day, with sets of 10 contractions, holding each contraction for 5 seconds. A powerful addition to this practice is the use of rose quartz balls. Used for centuries in Eastern practices for women's health, these balls are inserted into the vagina and naturally stimulate the muscles to contract to keep them in place. Rose quartz is traditionally associated with the energy of self-love and self-healing, bringing not only physical but also emotional benefits to this very important and often neglected aspect of our health. For women with conditions such as mild uterine prolapse or cystocele, it is important to start with gentler contractions and gradually increase the intensity. A 72-year-old woman who had given up on having a satisfying intimate life after being widowed for years and then meeting a new partner, shared that after 3 months of practicing this combined technique, she not only regained muscle tone but also rediscovered sensations she believed were a thing of the past. For those who prefer an even more natural and accessible approach, an alternative is to use a small, firm fruit such as a plum wrapped in natural cotton gauze as a weight for the exercises. This traditional practice has been passed down from generation to generation in various cultures as a way to strengthen the female intimate muscles. To enhance the results, these exercises can be combined with the consumption of foods rich in vitamin C and silicon, such as citrus fruits and dark green leafy vegetables, which aid in the natural production of collagen. The combination of these physical practices with proper nutrition creates a holistic approach to pelvic floor health, resulting in benefits that go far beyond the physical aspect, contributing to a deep sense of connection with one's own body. Our third and equally powerful natural solution for intimate health after 60 involves the use of phytoestrogens, substances found in plants that have a molecular structure similar to the estrogen produced by the female body. Isoflavone, found mainly in foods such as soybeans, chickpeas, and flaxseed, is one of the most studied and effective phytoestrogens. These substances bind to estrogen receptors in the body, helping to relieve menopausal and postmenopausal symptoms such as vaginal dryness and atrophy of intimate tissues. Unlike synthetic hormones, phytoestrogens act in a gentler and more balanced way, without the risks associated with conventional hormone therapy. A particularly effective way to incorporate phytoestrogens into your routine is through regular consumption of seeds. The seed rotation method, developed by nutritionists specializing in women's health, consists of consuming different types of seeds throughout the month to maximize their benefits. For 2 weeks, consume 1 tablespoon of freshly ground flaxseed daily. For the next 2 weeks, switch to a tablespoon of sesame seeds. This rotation allows the body to receive different types of phytoestrogens and other nutrients essential for intimate health. The seeds can be added to juices, yogurts, soups, or salads. For women with a family history of breast cancer or other hormone-sensitive conditions, it is important to start with smaller amounts and observe how the body responds. Although phytoestrogens are considered safe for most women, each body is unique. A 68-year-old woman who suffered from severe vaginal dryness and was afraid to use hormone therapies due to a family history of thrombosis began practicing seed rotation. After 4 months, she noticed a significant improvement in her intimate comfort and overall quality of life. In addition, her bone density tests showed stabilization, an additional benefit of phytoestrogens. To further enhance the effects, the seeds can be combined with adaptogenic herbs such as Peruvian maca, traditionally used to balance hormones and increase vital energy. Maca can be consumed in powder form, added to beverages or foods, at a dosage of 1 teaspoon daily. An affordable alternative to maca is Tribulus terrestris, a plant used for centuries in various medicinal traditions to support hormonal health and libido. Available in capsules or tea, Tribulus can be a valuable addition to your intimate health protocol. For women with diabetes or who need to control their blood sugar, it is preferable to consume the whole seeds with a balanced meal rather than adding them to fruits or sweet preparations. Combining these phytoestrogens with specific essential oils, such as geranium or clary sage oil, appropriately diluted in a carrier oil and applied in warm compresses to the lower abdomen, can create a self-care ritual that nourishes both the physical body and the emotional aspect of mature female sexuality. If you're tired of hearing that you simply need to accept the limitations of age, or that yet another medication is the only solution, know that there is another way. Here on this channel, we have gathered ancestral wisdom and natural knowledge that has already helped thousands of women like us regain their vitality after the age of 60. Subscribe now and join our community of mature women who are rediscovering the power of natural solutions for a fulfilling life. Turn on notifications to receive our weekly tips that respect your wisdom and experience. We are on this journey together, regaining our autonomy over our health one natural step at a time. And remember, the best age deserves the best care. Now that I have shared these 3 natural solutions for revitalizing intimate health after age 60, I want to emphasize something very important. You deserve to feel good in your body, in all its dimensions. For a long time, society has led us to believe that female sexuality has an expiration date, as if once we cross the 60-year-old threshold, we should abandon this fundamental part of our being. This message is not only false, but also harmful to our overall well-being. The truth is that female sexuality does not disappear with age, it transforms. And with the wisdom we accumulate throughout our lives, we can experience this dimension in an even deeper and more meaningful way. Many women discover, to their surprise, that after implementing these natural solutions, they experience not only relief from physical symptoms, but also a reconnection with their feminine essence. It is like rediscovering a part of themselves that was dormant, not for lack of desire, but for lack of the right tools to care for their changing bodies. The flaxseed oil I mentioned as our first solution not only moisturizes intimate tissues, but also contains lignans, compounds that help balance hormones naturally. Studies show that lignans can help protect against age-related diseases, including certain heart conditions. So, by taking care of your intimate health, you are simultaneously strengthening your cardiovascular system. A surprising discovery for many women is that by improving circulation in the pelvic region through the exercises I described, they also notice an improvement in urinary health. Mild incontinence, which many of us experience when laughing or sneezing, often decreases as the pelvic floor muscles strengthen. This gives us back the confidence to participate in social activities without the constant worry of embarrassing accidents. A rarely discussed but equally important aspect is how these natural practices can help prevent recurrent urinary tract infections, a common problem after age 60 due to changes in vaginal pH. By restoring the natural balance of the tissues, we create a less favorable environment for harmful bacteria. Another profound transformation that many women report after following this natural protocol is more restful sleep. This happens for several reasons. First, omega-3 rich oils help regulate sleep-related neurotransmitters. Second, the release of tension in the pelvic floor often relieves lower back pain that can disrupt nighttime rest. And third, reconnecting with one's sexuality releases endorphins and oxytocin, natural hormones that promote relaxation and well-being. For women who have undergone hysterectomy or other surgical procedures in the pelvic region, these natural solutions can be particularly transformative. Scar tissue often has reduced circulation, which can result in decreased sensitivity. The practices I have shared today help restore blood flow to these areas, potentially reactivating sensations that you believed had been permanently affected by surgery. A particularly beautiful aspect of this process of reconnecting with one's own intimacy is how it can strengthen long-standing relationships. Many women share that after implementing these practices, they have experienced a new depth of communication with their partners. By consciously caring for their intimate health, they feel more confident in expressing their needs and desires, opening the door to more authentic and satisfying intimacy. For those who are not in relationships, this process of self-care can be equally meaningful, as it represents an act of self-love and recognition of the integral value of your being, including your sensual dimension. Adaptogenic herbs such as Peruvian maca, which I mentioned as part of our third solution, not only support hormonal health, but can also increase overall energy levels. Many women notice that after a few weeks of regularly consuming small amounts of these herbs, they feel a renewed vitality that extends to all areas of life. This additional energy allows them to remain active and engaged in activities that bring joy and meaning, from playing with grandchildren to pursuing new interests and passions. A fascinating phenomenon that occurs when we take care of our intimate health naturally is what experts call the positive ripple effect. By nurturing this often neglected dimension of our health, we trigger a series of interconnected benefits: improved mood, greater confidence, more satisfying relationships, and an overall sense of being at home in our own bodies. And isn't that what we all want, regardless of age? To feel that we are fully inhabiting our physical existence, without areas of discomfort or shame. Contrary to what many conventional health professionals may suggest, intimate discomforts after age 60 are not simply a normal part of aging that we must passively accept. They are signs that our bodies are asking for a different kind of care, one that respects their innate wisdom and works in collaboration with their natural healing processes. The solutions I have shared today are not revolutionary new ideas, but rather time-tested practices that have unfortunately been overshadowed by the predominance of pharmaceutical medicine. By reviving them, we are not only taking care of our individual health, but also participating in a broader movement to value traditional knowledge about the female body. Before concluding, I want to emphasize that consistency is the key to lasting results. These natural practices are not instant solutions like a pill, but gradual investments in your overall health. Start by incorporating one practice at a time, allowing your body to adjust before adding the next. Remember that you are nurturing a renewed relationship with your body, and like any valuable relationship, it requires consistent time, attention, and care. The journey of rediscovering intimate vitality after 60 is deeply personal and unique to each woman. What works wonderfully for one may need adjustments for another. Observe how your body responds to each practice and don't hesitate to adapt the suggestions to your specific needs. This is true wisdom, knowing yourself deeply and honoring your body's innate intelligence. Finally, remember that taking care of your intimate health is not a luxury or frivolity, but an essential component of your well-being as a complete and multidimensional woman. You deserve to experience comfort, pleasure, and vitality in all dimensions of your existence. not only now, but for the many vibrant years ahead.